Hi everyone, welcome back to Learn With Me. I'm Deborah Hanson, and today we're going to be looking at AP Psychology 5.3, explaining and classifying psychological disorders. There are 3 CED questions for this section of Unit 5. We're going to start with the first one in this video. Okay, so just before we get started, just want to say thank you to everybody who's hit that like and subscribe button for me and left me comments and send me emails. It's been absolutely wonderful. I love hearing from you guys. I love seeing the comments, and thanks for getting those numbers going, which really helps me. I think with all of this YouTube algorithm stuff, I have no idea how it works. But anyway, whatever you're doing, it seems to be working. So thank you so much. And it does motivate me to keep making content. Also love all the suggestions from people about making review videos or videos about MCQs and FRQs. And I will get to that, I promise. So as you can see on this slide here, these are the key terms for 5.3, all of 5.3, including all 3 CED questions. Those are on a separate video, definition, and example so that you can learn the words, but also know how to apply them on your exam. And that's really important because, as I always say, the key to the 5 is really the key terms. Okay, let's get started. So in this video, we're going to discuss the first CED question for 5.3. Remember, there are 3, but this one is just going to look at number 1 and all the essential knowledge you need to know to be able to answer this question. The question is, describe the approaches used to define behaviors and mental processes as psychological disorders. Okay, let's break that down. Okay, so let's start by talking about what defines a psychological disorder, because understanding this helps us recognize mental health challenges and the factors that determine whether a condition qualifies as a disorder. So let's break it down. A psychological disorder is defined as a syndrome involving clinically significant disturbances in thinking, emotional regulation, or behavior. These disturbances reflect dysfunction in mental processes affecting how a person interacts with the world. But how do psychologists determine what qualifies as a disorder? Let's look at the key factors. Okay, so we're going to examine the factors used to define disorders. We're going to start with level of dysfunction. Does the condition cause significant impairment in daily life? So for example, someone struggling with severe anxiety may have trouble maintaining relationships or holding a job. Secondly, perception of distress. Does the person experience significant suffering due to their symptoms? Mental disorders often involve emotional pain, distress, or feelings of hopelessness. And lastly, deviation from social norms. Does the behavior significantly differ from societal expectations? So, for example, hallucinations, extreme mood swings, or compulsions may indicate a disorder if they disrupt normal functioning. So by using these criteria, psychologists can determine whether someone's experiences reflect a diagnosable mental health condition. Why does this matter? Because recognizing psychological disorders is essential for early diagnosis and treatment. Mental health conditions are not just personal struggles. They have biological, psychological, and social influences. So understanding these factors helps reduce stigma and encourages more people to seek support. Let's talk about how psychological disorders are identified and the different factors that influence diagnosis. Because understanding these factors is key to recognizing the complexity of mental health and the challenges that comes with labeling disorders. Let's break it all down. Diagnosing a psychological disorder is not always straightforward. There are several key factors that influence how mental health professionals identify disorders. Let's look at a few. First of all, we're going to look at cultural and societal norms, because what is considered normal behavior can vary from one culture to the other. A behavior that seems as unusual in one society might be completely accepted in another. The second one we're going to look at is stigma and discrimination. Factors like racism, sexism, ageism, that can impact diagnosis and access to treatment, sometimes leading to misdiagnosis or unequal mental health care. Next, we're going to look at positive consequences of diagnosis, because a correct diagnosis can lead to effective treatment, therapy, and support, improving an individual's quality of life. However, a negative consequence of diagnosis can be labeling or can contribute to stigma or discrimination, making people reluctant to seek help. So these factors highlight the importance of accurate and ethical mental health diagnosis. Let's look at an example. Imagine someone is experiencing intense anxiety. If their anxiety is persistent, excessive, and significantly disrupts their daily life, it may be diagnosed as an anxiety disorder. However, a diagnosis also depends on whether their symptoms are considered outside cultural norms. This is why cultural awareness and individualized assessments are so important in mental health care. We know it's important to diagnose people correctly, so let's look at how mental health professionals diagnose psychological disorders. The 2 main tools used for classifications are the DSM and the ICD. We're going to break both of those down. When diagnosing mental disorders, psychologists and psychiatrists rely on standardized manuals to ensure consistency and accuracy. The two most widely used tools are the DSM, that's the Diagnostic and Statistical Manual of Mental Disorders, and the ICD, the International Classification of Mental and Behavioral Disorders. This is how they work. We're going to start with the American Psychiatric Association, which has the DSM. Its full name, Diagnostic and Statistical Manual of Mental Disorders. We are on version 5, so sometimes you'll hear it referred to as the DSM-5. The purpose is to provide standardized criteria for diagnosing mental disorders, ensuring accuracy in clinical practice. So this is regularly updated to incorporate new research and refine diagnostic categories. And for example, the DSM-5 introduced new classifications and revised past criteria. The DSM is mainly used in North America and provides detailed descriptions of symptoms, severity levels, and diagnostic criteria. This helps clinicians make informed diagnosis and develop treatment plans. Now we're going to look at the World Health Organization's ICD. This is the full name, International Classification of Mental and Behavior Disorders. And the purpose is, it's a globally recognized classification system used to diagnose and track mental health disorders worldwide. The latest edition, the ICD-11, includes cultural considerations to improve diagnosis across different regions. Unlike the DSM, which is primarily used in clinical settings, the ICD is adopted by healthcare systems worldwide for medical coding, insurance claims, and international health research. Why do these tools matter? Well, using standardized manuals like the DSM and the ICD ensures that mental health disorders are diagnosed consistently and treated effectively. They help reduce misdiagnosis, improve access to treatment, and support mental health research globally. Now let's talk about how psychological disorders are diagnosed and the ethical considerations involved. Diagnosing a mental disorder isn't as simple as running a blood test. It requires specialized training and careful assessment. So here are the requirements for diagnosis. Diagnosing a psychological disorder requires a structured, evidence-based approach to ensure accuracy and fairness. Here are some key requirements professionals follow when making a diagnosis. First of all, specialized training. Only licensed mental health professionals, such as psychiatrists and clinical psychologists, are qualified to diagnose disorders. They receive years of training to ensure accurate and ethical assessments. Evidence-based diagnostic tools. Diagnoses are made using tools like the DSM-5 and the ICD to provide standardized criteria. Lastly, clinical interviews, questionnaires, and assessments. Mental health professionals conduct structured interviews, behavioral observations, and self-report questionnaires to assess symptoms and functioning. Because mental health conditions often overlap with other disorders, professionals must carefully analyze multiple factors before making a diagnosis. We also have to look at ethical considerations in diagnosis. While diagnosis is important for treatment, ethical concerns must always be considered. Here are two major ethical responsibilities of mental health professionals. One is avoiding bias and stigma. Diagnosis should be free from cultural, racial, or gender biases. Mental health professionals must be aware of societal stigmas that can influence their judgment. Second, reducing harm and ensuring accuracy. Misdiagnosis can lead to unnecessary treatment or worsen a person's mental health. Clinicians must thoroughly assess a patient before labeling them with a disorder. So, for example, some disorders like ADHD or depression can present differently in different cultural backgrounds, and a misdiagnosis could lead to incorrect treatments or reinforce harmful stereotypes. That's why ethical awareness is so important in the diagnostic process. Let's explore the benefits and challenges of diagnosing psychological disorders. While diagnosis can be incredibly helpful for treatment, it also comes with potential risks. Let's break that down. Let's start with the positive consequences of diagnosis. A correct diagnosis can be life-changing, giving individuals access to the care they need. Here are two major benefits of psychological diagnosis. We have access to treatment and resources. Diagnosis allows individuals to receive therapy, medication, and support services that can improve their quality of life. Secondly, validation of experiences. Knowing that their symptoms have a name can help individuals feel understood and provide relief and that they're not alone. So, for example, someone diagnosed with generalized anxiety disorder may finally understand their persistent worry and treatment options like CBT, cognitive behavioral therapy, and medication. Now we look at the negative consequences of diagnosis. So these also have challenges because we have to carefully consider them to avoid harm. Here are two concerns: stigma or negative labeling. A mental health diagnosis can lead to stereotypes, discrimination, or social isolation if misunderstood by others. Or we have overdiagnosis or misdiagnosis. Sometimes individuals are incorrectly diagnosed, leading to unnecessary treatment or missing underlying conditions. A great example is ADHD in children. If a child is misdiagnosed, they may be prescribed medication they don't need. But when diagnosed correctly, they can receive the right intervention, such as behavioral therapy or educational accommodations. Diagnosis is an essential mental tool, but it must be used responsibly to avoid harm. Accurate diagnosis helps people get support, while misdiagnosis can create unnecessary challenges. That's why ethical and careful evaluation is key. So here's some key points to remember. Psychological disorders are defined by dysfunction, distress, and deviation. Diagnostic systems like the DSM and the ICD are based on evidence and regularly updated. Diagnosis can have both positive and negative implications. So for the exam, be prepared to explain the pros and cons of using diagnostic tools and how cultural factors influence diagnosis. That's all the essential knowledge you need to be able to answer CED question number 1. Describe the approaches used to define behaviors and mental processes as psychological disorders. So if you found this helpful, please hit that like and subscribe button for me. It really helps me a lot. Leave me some comments if you have any questions, or if you just want to let me know what you would like to see in future videos. I always appreciate the messages. Thank you so much for listening. See you next time.